The ketogenic diet is a hot topic these days, with news stories and multiple health claims spurring interest in this extremely high-fat and low-carb diet plan. One major area of activity centers around how the ketogenic diet may help individuals diagnosed with cancer. The theories behind this potential health benefit are not new, they go back nearly 100 years. But emerging research in cellular metabolism and a handful of recent studies, including an AICR-supported study published in August, are adding insights into the possible effects of the ketogenic diet during cancer treatment. This is an important area of research that has the potential to significantly improve treatment responses, said AICR's Director of Research Nigel Brockton, PhD. There are plausible mechanisms by which the ketogenic diet could help make treatment more effective, but, as we see many times, plausibility alone is not enough, it has to be tested. That's why we are supporting research in this area. Currently, no major cancer health organizations, including AICR, recommend the ketogenic diet for cancer patients, or for cancer prevention. Note, the ketogenic diet was developed in the 1920s to curb seizures. Today, it is an accepted medical option for children with epilepsy who do not respond to standard treatment. Other disease-related health claims continue to be investigated. About the ketogenic diet: take a high-fat, low-carbohydrate diet to the extreme and you have the basics of the ketogenic diet. The average American eats close to half of our calories, 47 to 50%, from carbohydrates, 33% from fat and 16% from protein. The classic ketogenic diet is composed of 5% or fewer of daily calories from carbohydrates, 80% from fat, and 15% from protein. For someone on a 2,000-calorie diet, that means eating less than 25 grams of carbs per day, about the amount in one apple. This diet is challenging for many individuals to follow long-term. There are versions of it that contain more carbs, especially the plans targeted in the popular press. For someone undergoing cancer treatment, even proponents of the ketogenic diet note that it should be closely supervised by one's health care team. How the diet relates to cancer: all of our cells need the energy to survive, and the fuel for that energy comes from the digestion and metabolism of food. The fuel of choice for most cells is glucose, sugar. It is delivered to cells from the blood, primarily from the digestion of carbohydrates. A healthy cell pulls in glucose that then goes through a series of reactions with oxygen to produce usable energy. In the 1920s, German scientist Otto Warburg found that cancer cells fuel their growth through metabolizing a large amount of glucose. Unlike the average healthy cell, he saw that cancer cells were converting glucose into energy without using oxygen, even when oxygen was readily available. Now called the Warburg effect, this phenomenon is seen in about 80% of cancers. The oxygen-free pathway used by cancer cells needs a lot more glucose to produce the same amount of energy as an oxygen-using cell. This realization led to imaging techniques where cancer cells can be detected by spotting